Good evening, everybody. Hope you're all doing well. It's another installment, another episode of Wellness 360 with myself, Dr. Kelvin, and I'm super excited to come your way this evening. As we do it all the time here, we learn about our health because, even though our focus is on making money, it's also important that we also keep our health in check, so that when we eventually make the money, we will have the energy, we'll have the strength, we'll have the capacity to enjoy that money. And at the foundation of all of that is our health, because once we are healthy, then it means that we actually can go out there and do more productive work. And so it's very, very important. In fact, it's critical that we understand our health to a larger degree than we already do. And this evening it's not going to be any different. We're going to go out there and learn a lot about ourselves. We are going to learn a lot about how we function, especially women, because today we are discussing a topic that's very, very sensitive, very dear to our hearts. When I say our heart, I'm talking about we, the men. It's very dear to our heart because if you understand the subject we're going to discuss, you're going to really enjoy life, literally. And so, without further ado, we're going to jump straight in. Today's topic, we are discussing the menstrual cycle, safe period, and emergency contraceptives. Now, I posted a video earlier where I spoke about the fact that some people, some guys have missed this safe period, and it's really cost them. It's cost them a lot. And so, if you don't want to be a victim, if you don't want to be one of the people who miscalculated, then this is definitely a session that you need to be a part of. And so, I'm going to introduce our guest. Our guest this evening is an amazing doctor. She's a general practitioner currently working at 37 Military Hospital, the foremost military hospital in Ghana at the moment. And she also holds an MPH, and so she's definitely the right person to be discussing this subject with us. And of course, she's also a woman, so she lives through this every day. And so this is why she's the best person to discuss this topic with us. And so without further ado, I'm going to introduce our speaker for this evening, Dr. Erajua Nunu. Doc, how are you doing?
I'm fine, thanks. And you?
I'm very, very well. Good to have you here. Thank you very much for us accepting to be part of this evening session, even in spite of your busy schedule.
I know, right? Thanks for inviting me.
Great. Well, let's dive right in. This is a big topic we're trying to reduce and compress into a limited amount of time. So let's dive right in. So my first question, and this is a question that I get quite often, and interestingly from both guys and ladies as well. So the question is, should a woman have a period every single month?
Should a woman? Well, that's a very tricky question. Ideally, you should. Every normal woman, normal in quotes, because it depends on a lot of factors, but ideally, every woman should have their menstrual cycle every month. So they should have their menses every month. Okay. Sometimes we have delays because of pregnancy or probably stress or you're sick or something. Those that exercise a lot, the sporty ones, they tend to have very regular menstrual periods. But ideally, a woman should menstruate every month. But science.
Yes, I know.
So, yeah.
So, I think you touched on some of the issues already. So, what are some of the reasons why a woman may miss her period? I'm using the term advisedly, but you get what I'm saying. What are some of the reasons why a woman might miss her period?
Obviously, it's pregnancy. That's like the commonest one. Once your period doesn't come, that definitely you are pregnant. It could also be as a result of stress. So let's say you have some exams ongoing, or you have some sickness, some illness, you've had a major surgery or something of some sort, so you've gone through a lot of trauma. It can delay your periods. Also, not eating too healthily. Some people would be fasting or they are starving for certain reasons, so that can also be an issue. Then we have the hormonal imbalances. Okay, those who have polycystic ovarian syndrome, those who have thyroid diseases and all that, the hypothyroid and all that, they also tend to have problems with their menses, so they're not so regular. But most delays are caused by either pregnancy or stress, and then those who are quite sporty as well, you see the athletes, those who tend to exercise, they would run for quite a number of miles and all that as well. They also have irregularities in their menstrual cycle. So they probably just bleed for like a or two, and then they have very short cycles as well. So those are factors that affect the presence or absence of your menstrual cycle.
So basically, in summary, it's not only pregnancy that can make a woman miss her period. Okay. So, that's good information.
As well, when you are taking contraception as well, I mean, it will not come. So, or it will be quite irregular. Maybe it comes this month, doesn't come the following month, and all that. So, having some form of contraception will affect your periods.
Okay. So, what's the typical menstrual cycle? How does it look like?
Okay, so ideally, usually lasts for about 28 days to 30 days, but everyone is different. And we have women that just last for as long as 40, 45 days, and some as short as 20 days and all that. So everyone is different, but just know what your pattern is, because that's what will guide you and help you as to know when you are safe and when you're not. So I'll use, because the average is usually like 28 days, so I'll just use a regular 28 days to just kind of explain how the cycle should be like. So ideally, your day one should be when you start having your menses. So that's when you actually see the blood flowing. Okay, that's your day one. Usually lasts for about 5 days. So from day 1 to 5, that's when you bleed. And then usually by day 5, day 6, you shouldn't see much. Some people may bleed as long as 7 days, Others also bleed as short as 3 days, but it depends on the woman and a lot of factors as well. The only thing that's worrying when it comes to your menses is when it changes. So let's say you used to bleed for 5 days, and now it's like just 2 days. Then now I can be thinking, okay, what is wrong? Or let's say you used to be a light bleeder, but now you're bleeding heavily, or there are clots, or there's a lot of pain when you bleed, your abdomen hurts and all that. Then that one you can think of problems or something is going on somewhere. But if you always bleed every 28 days and it lasts for 5 days, it's always been like that since day one, you have nothing to worry about. Okay. So usually from day 1 to 5, it lasts for that long, and then you ovulate between day 10 to day 14. So you count day 1 as the first day when you actually bleed. So the safe period is between the day 5 and then the day 10. Okay. Because the reason being, when you ovulate from day 10 to 14, I mean, now you have an egg out. So once you have sex, unprotected sex, the sperm can actually fertilize the egg and then get you pregnant. So you wouldn't want to have sex when you're during ovulation or just after ovulation, because if you do that, definitely you end up being pregnant. I mean, a fertile woman, all things being equal. So that's the way a regular or a normal cycle looks like, So you have to know how long, what the cycle is, how many days you bleed, and then notice the patterns. How many parts are you using? You use the same number of parts? Is it increasing? Are you getting clots? Are you having abdominal, pelvic, or back pain? So notice all those things. And if anything is different, you always have to report to your GP or your guy.
Okay, so I actually have 3 questions from what you just described. I mean, these are questions. 2 of them I received before this session. So, and just as an aside, if you're on this live session and you have a question you want to be addressed, please post it in the comment section either on Zoom or on YouTube, and I'll pose the question to Dr. Nunu so that she can address it for all of us. So, first question. Now, you mentioned that typically women should bleed about 5 days. Now, the question I received is, Doctor, when I have my period, I bleed for only 2 days. Can I have children when the time comes? So my question to you then is, does the duration of the bleeding affect fertility?
Well, not necessarily. Once it has always been like that from day 1. It's only when you've noticed the change that you have to be like, okay, maybe I have to now go and do further investigations and all that, check your hormones and be sure that everything is fine. But if you, from day one, when you started your periods, you've been bleeding 2 days, I mean, it lasts for 2 days, you're fine. Everyone is different. So it doesn't mean because AC bleeds for 10 days, also has to bleed for the same 10 days. Because we have we have different hormones, we eat different foods, we have different kinds of stresses all over us and all that. So I mean, you can't compare yourself with other women. Just know what's your body does, or what the regular thing is for the body, so that when you see any change or any abnormal thing that's a bit different, then you know that okay, I have to seek help.
And I mean, it's interesting that you mentioned food and what we eat, because there's a relation between your blood level and even how much bleeding, right? I mean, if you're anemic, you can't obviously bleed plenty, right?
I mean, if you're anemic, if your HB is like 5, you don't expect to bleed like 6-7 days, because where is the blood that's going to come out in the first place, you know? So
Exactly.
you need to right, make sure your blood level is fine, your HB is good, you know, preferably 11, 12, or even higher if you can get, you know. And then more fruits, more vegetables incorporated in the diet as well.
Great. And then, so the second question, and this is quite practical. So somebody wants to know, in fact, somebody also called Adjoa wants to know, how does she determine her cycle? I mean, you mentioned that you should know your cycle and other things. So she wants to know practically, how can she know her cycle?
Okay. So the easiest way, and I usually tell a lot of people, if you have either Android phone or an iPhone, there's this app called the Flow app, FLO. You know, you can just download it on your phone. What happens is that every time you have a period, you log it in. And then over a period of time, it can actually tell you everything about how your menstrual cycle should, like it, or how you flow, how many days it takes you before the next cycle comes and all that. So it gives you some reports, okay, in case you can't, you know, memorize your dates in your head and all that. But you can also do the old school. You can get a diary, get a pen and paper. Every time you have your menses, you just write the date. So let's say I had my period on the 20th of October, you write it down. The next month it comes again, maybe 16th November or something, you write it down. So by doing so, then you can be able to count the number of days between that 20th of October to the 16th of November and then to the next one. So you can tell whether your period is coming every 28 days or every 30 days or every 35 days or something. But the app is like the quickest way. I've used it with a lot of patients and I use it myself as well. And it's quite, it's good. It even tells when you're ovulating and all that. It tells when your period is going to come for the following month. So you get to make your plans well and adjust to the day your period will come, so that you know at least you have your pad on you and all those things, you know.
Yeah. Well, I mean, the way you put it seems it's not complicated at all. So how come so many women don't know their cycle?
Very, very simple. You just have to just log in your last menstrual period. That's all you need to do, and it just does everything for you.
Wonderful. Maybe we should take a survey. If you are not too shy, if you know your cycle, put it in the comment section. If you don't know your cycle, put it in the comment section as well. Hey, that's just an aside. So let's move on. But I mean, so since you brought in the app, I'm sure that the app can also tell you when your safe period is, right? Am I right?
It does. It tells when your safe period is, and it tells when you are most fertile as well for those who want to have children. So we'll let you know this is your most fertile window, this is your most fertile period, or this is when it's safe for you. So it gives you the guide, and then you know what to do at what time, depending on what you want. If you want to have a baby or a pregnant, which one to do. So the app actually would actually ask you that do you want us to monitor you contraception or you want to for fertility issues. So we'll ask you which option that you prefer. So based on what you give it, it will direct you and then guide you as to when, if it's a baby that you want, then it's when it's your fertile period, it prompts you. But if it's about abstinence, it will tell you, okay, between this time and this time, you have to abstain. So it depends on what you talk about. So just that's accordingly.
Yes. Thanks for that clarification, because I remember somebody. I mean, this equation of safe period is. I mean, somebody who wants to get pregnant should actually avoid the safe period. So I think that's what you're trying to explain. The safe period is for people who don't want to get pregnant. So if you want to get pregnant, then you should actually avoid the safe period, because you will not get pregnant if you have unprotected sex during the safe period. So
Yeah.
know what you want, and then act appropriately. All right, there's a question from another Adjoa. This time it's Adjoa Sewa, and she wants to find out, how does your blood level affect your menstrual flow? As I thought it was just an expulsion of unfertilized egg from your uterus. I'm confused, please. Okay, so this is a question to you, Dr. Adjoa from Adjoa Sewa.
Okay. My namesake Adjoa. Well, it's not just the egg that comes out. Okay, so the what happens is that your body, after you ovulate, okay, your body prepares your womb for a possible baby. Okay, so when you bleed, it's not just the blood coming out, but it's also that preparation, that lining that develops in preparation of the baby in quotes. So because you don't get pregnant, the uterine line has to shed off, or it has to come out, and it comes out in the form of bleeding and a lot of things. So that is why someone who has a low HB cannot be able to bleed so much, because you don't have enough red blood cells. So where is the bleeding going to come from? I hope that answers your question, Adrasewa.
Well, I mean, that sheds more light on the issue, and it makes a lot of sense. I mean, the body is also trying to protect itself, so it's not going to let blood flow when you don't have enough. So it's a kind of a protective mechanism as well. Thank you very much for that question, and thank you for the clarification as well. Yes, Adjoa says she understands very well. Great, okay. Great. So if you are on the live session and you have any question, do post it up so that I can pose it to Dr. Nunu, and then she can address it for all of us to learn. All right, but so basically, so the menstrual cycle, every woman, so I'm just summarizing, every woman has a different menstrual cycle. It could be 20, it ranges from 20 days all the way to 45 days, but averagely about 28 days, So don't just assume that you have a 28-day cycle, because indeed, if you have a 35-day cycle, you may not menstruate every calendar month. Yeah. And so know your cycle so that you know when your period is coming. And also, when you know your cycle, it's easier for you to determine when your safe period is. But now, let me ask you, Dr. Nunu, would you recommend, and I know this kind of is a self-answering question, but would you recommend that people who are trying not to get pregnant should use the calendar method? And maybe you can start by telling us what the calendar method is, and then tell us what your position is on the calendar method of contraception.
The calendar method, well, if you know how to do it and use it well, I think it should be fine. The only problem is if you're not able to use it well, then I mean that's when you have problems with it. But you should know your cycle very well if you want to use the calendar method. And you should know when you should note your period down anytime you have it, okay? Because that would give you an idea of how often your period comes. It will let you know. You need to know how many days it lasts for. You need to know that day 1 is when your menses starts, and that from day 1 to day 10, at least you know that within that time, it's a bit safe for you. But after day 10 to the end of the menstrual cycle, it's not the best for you. So it's up to you if you're able to do the calendar. If you have a calendar, first of all, and you know how. Because now I think people don't really use calendars anymore, do we? Because we have them on our phones and all that. So you hardly see people like with calendars. But I mean, you never know if you still have a calendar in your room and all that. You can still, or you can use the cycle beats. I think the cycle beats are a bit easier. So the cycle beats, I don't have them here. But they're just the ring. They also help with the movement. So I get to know, okay, this day 1, day 2, let's move it around and all that. You can get at any family planning unit. I think that's also quite effective. Because the calendar method, I don't think people use it anymore. It's a bit archaic, Now, when you have the flow up and all that, you don't need the calendar method.
But if you were, for instance, if you were trying not to get pregnant, and I mean looking at all the contraceptive methods available, should you be focused so much on the safe period calculation, or would you say that, I mean, you should go for something else?
The safe period can fail, like I said, I mean, anything can happen. You think that, okay, I'm going to ovulate on day 10. Never know, maybe I ovulate on day 9, So, I mean, if you don't want to have a baby, I feel like you should use multiple forms of contraception, not just use one form. Okay, so that just in case one fails you have a backup. So, assuming you want to use the calendar method, that's fine, but still have a condom that you can use, or have a pill that you can use, an implant or something, not just rely on just the calendar method, because then if that fails, then you're in trouble. And you know that most of these things are 100% effective,
Yeah.
So if you are going to rely on just one method and then it fails, then what are you going to do next? That means you have to probably rely on contraceptive, and then that's also another issue, So, I mean, I always have multiple forms of contraception. That's what I always advise people. Don't just focus on one, just in case it fails. Someone said the safe period is a scam.
I mean, I think one of the most frustrating things about an unplanned pregnancy and baby is the fact that you have to spend money to buy diapers. Charlie, even when the baby is planned, when you're buying diapers, it's annoying, and now the baby was not planned. So please, if you don't want to buy unplanned diapers, don't depend on the calendar method or the safe period calculation, because it will, in fact, the probability that it will fail you is significantly high. So please avoid it. But this is leading me to my
it can do anything at any time, It can decide to ovulate today. And you can ovulate tomorrow. So, but you're not really safe.
I'm telling you. I think I said, well, do you want to share a story with us? The way you are saying is a scam there.
My phone, baby.
Oh, okay. I was practicing safe period. Now I understand why it's a scam. Anyway, so I mean, this brings me to my next set of questions, which is, so now assuming your safe period calculation failed and you are not too sure whether you are pregnant or not, let's talk about emergency contraception. First of all, who can take emergency contraception?
Okay, so anyone can take it. I mean, any woman can take it. The only issue is that it should be taken right after it has a period. So let's say between, I think it lasts for about 5 days, 3 to 5 days. So let's say you had unprotected sex, let's say on a Tuesday or something. At least by either that same Tuesday or that Wednesday, you have taken the pill. The reason being, the longer you take the pill, the lower the effectiveness of the emergency contraceptive pill. You understand? So if you want it to be effective, take it as soon as you've had the unprotected sex, within at least 24 hours. If you delay by 48, 72 hours, I mean, still it's effective. It's like it's coming down. So if, let's say, it was 90% day 1, by day 2, day 3, it's maybe 80% or something, or maybe 70%. So my advice is that if you want to do the emergency contraceptive pill, make sure that as soon as you've had the unprotected sex, that you remember that, oh, okay, it's not my safe period. Then you take it. Don't wait. Or like they 3 or 4 days, they're like, hey, I just remembered, it's it's not my safe period. You now it, and then you get some surprise later on. So you have to be quite how you use it. And people tend to abuse it a lot as well. You hear talking about it, Postino 2, and I'm always taking Postino 2, and And now when you want babies later on in life, you can't get a baby. I'm wondering why you can't get a baby. Because you've just really worried your hormones and created such a huge hormonal imbalance, and then your menstrual cycle becomes all over the place. So people should not abuse this form of contraception. It's only for emergencies. It's not like every day you're going to buy a contraceptive pill. Like they don't take it like water or something, It's just for emergency. So emergency means emergency. Like you really, really at that point remember that, oh, it's my unsafe period, or I'm ovulating and I had sex accidentally or something, and you really don't want that baby, fine, then you go and take it. But it's not like it should be a regular form of contraception. And most young girls are using like that, but that's not the best. If you want a regular form of contraception, just go to the family planning unit. You sit down, we give you a range of options, and then you choose from different options. We'll find something that works for you and then works for your body. So don't rely on an emergency contraception to pill to help you. And it can fail to, it's not 100% effective in any case. So if you want a better form of contraception, you want to protect yourself, please use better forms of contraception. Okay.
All right. I mean, Ajua Sewa has taken the wind out of my sail. She's asking, how often how often can one take the emergency contraceptive pill? So that's what she wants to know. How often can somebody take the emergency contraceptive pill?
Like I said, so it's an emergency pill. So when I say emergency, that's emergency okay every day. No, unless if you find every day you want it to be an emergency. Emergency. When I say emergency, maybe once a month, once every 3 months, once every 6 months, even once a year, crack can be enough. It shouldn't be like every day. No, it shouldn't be so continuous like that. I mean, give your body some time. So just then when you need it. That's the use. I mean, that's why we even developed that pill. It's for emergency situations only. Just that people are just using it for other, their own personal gains. But ideally, it should be just for emergency. So you don't get an emergency every day. So you can't be using it every day.
I mean, I think that what they say that if you have to use the emergency pill more than 2 times, then it means you should be on a proper long term contraceptive. So yeah, if you've had reason to use the emergency pill more than once, then it means that you should actually be on proper contraceptive. So as Dr. Nunu has already mentioned, you need to go to the family planning unit and then have a discussion with them. And you see, just as we are saying that every woman has a menstrual cycle that is unique to that woman, is the same way that the contraceptive that works for you, it should be unique to you. Don't take somebody's advice and go and take the contraceptive they are taking, because it might not work for you. It's very, very important. Very, very important. I mean, anyway.
Point you've mentioned. Because someone come and say, oh, this person took this pill and gained weight and did that. You might take it and you'll be fine. We have different bodies, so you can't listen to someone's side effects and let that also affect your decision to take a particular contraceptive.
You can't collect somebody's side effect and make it your own. It doesn't work like that. So anyway, another question related to the emergency contraceptive pill. So somebody wants to find out. So she had to take the emergency pill sometime 2 weeks ago, and then her period was supposed to have come earlier. It was supposed to come over the weekend, as in per her original schedule. Her period was supposed to have come over the weekend. Till now, she's still not had her period. So she wants to know, why hasn't she had a period? Is the emergency pill responsible for her not having a period, or what? That's the question she's asking.
But most likely it is, because it's a hormonal thing you're taking in. I think that's the progesterone, the levonorgestrel. It's a progesterone-based thing you're taking in. So once you're taking a hormonal thing, you're going to change how you're going to change your menstrual cycle, in that you are probably not going to ovulate for your next cycle. So it takes a while for you to get your regular cycle back again. So give it some time. It would come. That will not be immediate.
I guess this is why you shouldn't abuse the emergency pill, because as Dr. Nunu has said, it disrupts your cycle. So then now you have to literally start all over again and then chart your date and then now figure out what your new cycle is. So it's not something you want to be abusing, really. Anyway, Doc, so now there's a question here which is going to push us into a discussion on ethics. I don't know if you're ready for this one, but I'm going to ask it anyway. So still in relation. now it looks like a lot of people were waiting for the emergency contraceptive. So once that topic came up, I mean, it's opened a lot of areas. So I'm sure you know the question that's coming. Somebody wants to find out, isn't the emergency pill a form of abortion?
Abortion, wow. This one is debatable.
Mhm. That's why I said we are entering into the realms of ethics.
I know, right? Well, technically, you don't really have like a fetus yet. For you know, even fertilization hasn't even occurred. The thing is that you are just preventing, and what the pill does is that it just preventing the fertilization from occurring. So from the egg meeting up with the sperm to form a baby and all that. So the pill just disrupts that thing. So you're not even creating the embryo or the fetus or the connection yet. Okay, to call it an abortion. If it's an abortion is, you know, the fetus has been formed or um before already the egg and sperm have already met and all that, fine. And you can say it's an abortion. But the pill disrupts that joining together. So they haven't even fertilized. It doesn't make fertilization take place. Let me put it that way. So I don't think it's abortion because technically a fetus or an embryo hasn't been formed yet. That's what I think. I don't know what you have to add on, Dr. Kelvin. That's what I think.
Well, I mean, as you said, it is a controversial area. I mean, some people believe that pregnancy occurs after implantation, as in when the egg and the sperm have fused, and then the resulting embryo has now implanted, has entered into the womb and has settled down. That's when pregnancy is established. Others also believe that once the egg and the sperm have fused, it's pregnancy. So if you belong to the school of thought that says that once there's egg and the sperm meet, a baby is already formed, then I guess you can say that it's an abortion. But if you're on the other side that says that it is only on after implantation that pregnancy has established, then I guess to you it's not going to be an abortion. So basically, I think what Dr. Munu says is that this question, only the individual in question can answer it. But having said that, why do you want to put yourself through this ethical dilemma? Why not use protection, or why not take regular contraception so that you don't have to answer this question at all? And if you don't want to answer this question, then don't go and have accidental sex. Period.
Okay, that's it. Well said.
I mean, that'd be the whole story, you know. Because I mean, these issues are real. I mean, these are issues that we as medics deal with all the time, you know, and oftentimes patients don't want to take the decision for themselves, so they come and put their burdens on you, and then now you as a doctor have to deal with the ethical dilemma. But I mean, I think that's also why we are doing these sessions, so that at least you are aware that there are options out there, you know. So the emergency contraceptive is an option. It's not the only option. There are other options that you can put in place even before you get to the point of emergency contraception, you know. But having said that, Dr. Nunu, there's a very one aspect, one place where emergency pill is really, really important, and that's in dealing with rape victims. I don't know if you've had any experience with that. If you can just share with us how you know we use the emergency pill in that regard.
Yes. Well, because most of the cases of rape, I mean, the babies are not wanted. There's no way most of the mothers would want to keep the babies. I mean, you've had rare cases where they would want to keep, but I mean, most of them, because they don't want any link between the rapist and then to them, so they'll just probably want to cut off all ties. So most of the time, we do give them the emergency contraceptive pill and then the counseling, and then we also check for the HIV as well and all that, just to be on the safe side. But in those cases, yes, we usually recommend the emergency contraceptive pill for them, because that's indeed an emergency, and at that time it's needed. It wasn't a planned pregnancy, so you wouldn't want to just disturb the mother and then give her any problems. You just want to just cut all ties between her and the rapist.
Definitely. Well, gradually we are coming to the end of the session. I've learned a lot already, and I hope you, the audience, have also learned something as well. If you have any question you want to ask as we are wrapping up, please drop the question in the comment section on YouTube or on Zoom, and then I'll pose it to Dr. Nunu, and then we can address it for you. But as we are wrapping up, Doc, when would you say is a normal age for girls to have to begin to see their menses? or maybe I should, okay, so that's one aspect. When should a girl start seeing her menses? And then at which point, if they have not yet started menstruating, at which point should the parents be concerned?
Okay. So ideally, it should be around age 12. But things have changed now. We're getting girls as young as 9, getting their menstrual cycle and all that. If by 16, 18, you're not seeing your menses, I think you should get worried. Because at least by 12, 13, 14, your early teens, you should be bleeding by that time. You know, you don't want to get to 16, 18, and then it's not coming. Because 12, 13, that's when the puberty starts. That's when you're seeing the breast, butts, and all those things, the facial hair and all that. So if your hormones were working, I just start bleeding around that time.
Great. And then the other extreme, at which point should menopause, when would you say menopause is at which age do women start experiencing the menopausal symptoms, and when does the period actually end?
55. Now we are seeing 45, I had a very rare case this one time. This lady was 38 and she just was not having a period anymore. And we did everything. They said it was premature menopause or something, You get to hear those scary things and it scares you, but I mean, all our lifestyle as well, things have changed. But menopause used to be at least age 55 or at least 50 and above. But now you get 45, 46, being menopausal, 48 getting menopausal. So now the age is between, let's say, age 45 to 55 now.
Wow. Thank you very much.
Just like the men instead of 12 is now 9 years old getting their period. So things are changing.
Well, maybe it's because we are eating better food. I mean, you already mentioned that there's a link between your blood level and how much bleeding you get. So now, if our children are eating much healthier diets, of course, they're going to start developing much earlier.
That's a possibility. Who knows?
So I have 2 questions that have just popped up. So the first question is fibroid. Is there a link between fibroid and menstruation? That's the first question.
Okay. So with fibroids, you tend to bleed quite heavily when you're having your menstruation. Okay. We say menorrhagia, but usually they bleed quite heavily and then with clots. Okay. And they tend to have a lot of pain as well. They may have back pain, they may have pelvic pain, abdominal pain and all that. So when you have fibroids, you bleed heavier than normal or heavier than you should. So usually those are red flags. Once your bleeding starts to get very heavy, it's advisable for you to see your GP, who would recommend a pelvic scan for you to do. And once it's done and we see the fibroids, then we refer you to see the gynae. And then they continue from there.
All right, thank you very much. And then I think this is the final question. Michael wants to find out, what are your thoughts on the use of intelligent fertility and ovulation tracker or monitor devices such as Daisy, especially for birth control? Wow. I think you mentioned the Flow app earlier on, but
I haven't heard of Daisy yet, but maybe similar to the Flow app. Is it like an app where you put he has to give us some clarification because I don't know what he's talking about. Is it
I mean, I should guess, I should think so. But Michael, if you can clarify the question, is the Daisy an app or is a device? Because we already spoke about apps that can help in tracking, but this Daisy is unfamiliar to us. So if you can let us know if it's an app or it's a device that helps, I mean, that would be new information we are getting. But yes, Dr. Nuno already mentioned that there are some apps that you can use to help you keep track of your cycle, your safe period, your unsafe period, and even it can even tell you when you are most fertile. So if you are trying to achieve a pregnancy, you know which day to plan and put some roses on the bed and get your views on. Anyway, so Michael, if you can clarify that for us, I'll be grateful. But we are wrapping up at the same time. So, Dr. No, thank you very much for your time you spent with us. But if you have any final words regarding menstrual cycle, emergency contraception, and safe period, please do share with us at this point.
All right. So to wrap up, I'll just say that no woman is the same. I mean, we have different menstrual cycles, different days when we bleed, different periods for ovulation and all that. So just because someone bleeds for 5 days and you bleed for 2, I mean, once it's your normal pattern, please don't get worried about it, okay? And if in any case you do feel like there's something wrong, please always seek help. See your GP, who would probably do further test and studies and then refer you to a gynae, depending on what he or she sees with the labs, okay? And if you're not ready to have a baby, please use proper don't abuse the emergency contraceptive pill. It's only for emergencies, I beg, only for emergencies. And you have a major safe period can fail you. So don't rely on safe period too. Please get a good method, or maybe use 2 methods to protect you. I have women can use condoms. I have a female condom here. I don't know that you've seen one before, but we have female condoms for women. We have the male condoms for men. Please use your condoms if you're not ready to have babies, if you're not ready for STIs. The thing about condoms is that it protects you from having the sexual transmitted infections as well. So besides avoiding the pregnancy, protect yourself from infections like HIV, hepatitis B, syphilis, and all those ones, chlamydia, gonorrhea, and all those things that you don't want to get. So please always protect yourself at all times. Tomorrow, today is actually World AIDS Day. So please know your HIV status. If you don't know, please check. It's free. You can walk into any clinic, have it checked. I did mine yesterday at work. It was painful, small, but at least I knew my status and I was happy that I was negative. So please just check yours and then just know and have that peace of mind. And then please practice safe sex. Okay. That's all I'll say for now. Thank you.
Perfect. Thank you very much. Thank you very much. It's been an insightful session. We've had a good time. I have learned a lot. I'm sure our audience has learned something as well. And I mean, thank you. Thank you for spending time with us. So guys, this is it. Wellness 360 with Dr. Kelvin. This evening, we learned a lot about menstrual cycle, safe period, and emergency contraceptive. If you missed the live session, you can follow the replay on YouTube. Make sure you subscribe to the channel and put on the notification bell so that when new content is put up, you get notified as well. So once again, thanks for joining us. And then you can still post your question and we will address them even if it comes after the session. So enjoy the rest of your evening. Stay blessed. Bye-bye.
Bye.